Hello, everyone, and welcome back to Pharma Insights, where we simplify the big topics in the pharmaceutical world. Today, we're diving into something that sounds a little heavy, but trust me, it's super important: the profile of microbiological load in the pharmaceutical industry in India. Sounds complicated? Don't worry, we'll keep it easy, fun, and clear. What does microbiological load even mean? So, first things first, what is microbiological load? In simple words, it's just the number and type of tiny living organisms like bacteria, fungi, and spores that are present in the environment, water, raw materials, or even on people working in pharmaceutical plants. Think of it like germs that sneak into places where medicines are being made. And in India, where the pharma industry is one of the largest in the world, controlling this load is a big deal. Where do these microbes come from? Now, microbes are everywhere. But in a pharmaceutical factory, the main sources of microbiological load are 1. Raw materials. Natural stuff like plant extracts, starch, and gelatin come with a high germ count. Synthetic chemicals are usually cleaner but can still pick up microbes during handling. 2. Water systems. Water is used everywhere in pharma: cleaning, mixing, even making injections. If not treated well, water can harbor bacteria like Pseudomonas or Burkholderia. 3. Air and environment. Dust, moisture, and air particles can carry spores and fungi like Aspergillus or Penicillium. 4. People. Yes, workers. Human skin and hair are full of microbes like Staphylococcus and Micrococcus. That's why clean room suits and masks are mandatory. 5. Equipment and surfaces. If cleaning isn't done properly, bacteria like Bacillus cereus or fungal spores can stick around. The common culprits? Okay, so who are the usual troublemakers? From skin and air: Staphylococcus epidermidis, Micrococcus luteus. From water: Pseudomonas aeruginosa, Burkholderia cepacia. From raw materials and dust: Bacillus subtilis, Aspergillus niger, Penicillium. From persistent contamination: spores that just don't die easily, like Geobacillus sterothermophilus. How much microbiological load is allowed? Now here's the tricky part. We can't eliminate microbes completely, but we can control them. Different pharma zones have different limits. Grade A, critical clean area like filling injections, practically zero microbes allowed. Grade B, less than 10 per cubic meter of air. Water for injection, WFI, less than 10 bacteria in 100 milliliter, and absolutely no dangerous endotoxins. Non-sterile medicines, tiny amounts of bacteria or fungi may be allowed, but no harmful ones like E. coli or Salmonella. Why this matters? In India is called the pharmacy of the world because we supply medicines to more than 200 countries. That means international regulators like the US FDA and WHO are always checking our factories. If microbiological load is not controlled, products can get contaminated. Patients can fall sick. Companies can lose approvals or face recalls. So controlling microbes is not just about science. It's also about India's reputation and economy. How do we control it? So what's the defense system against these invisible invaders? GMP, good manufacturing practices, strict rules for cleanliness. Environmental monitoring, using air samplers, settle plates and swabs. Water quality testing, making sure purified water and WFI meet pharmacopoeia limits. Sterilization and disinfection, autoclaves, clean rooms and validated disinfectants. Personnel hygiene, gowns, gloves, masks, and proper training. So, to wrap it all up, the profile of microbiological load in India's pharmaceutical industry tells us what kinds of microbes are present, where they come from, and how we control them. It's like making sure the kitchen where your food is cooked is super clean, but on a much bigger and stricter scale, because here we're talking about life-saving medicines. That's it for today's episode of Pharma Talks. If you enjoyed this, don't forget to subscribe and share with your friends who are curious about how medicines stay safe and effective.